Stroke is one of the most serious medical emergencies we face. And in this video, I want to walk you through exactly what happens when a stroke occurs. A stroke happens when blood flow to a part of the brain is suddenly blocked or interrupted because the brain can't store oxygen. Even a short pause in blood flow can cause brain cells to start dying. This is why stroke care is always urgent. Every minute matters. There are two main types of stroke. The first, and most common, is an ischemic stroke. This happens when a blood clot blocks a vessel in the brain, cutting off blood supply. The second type is a hemorrhagic stroke, which occurs when a blood vessel bursts and causes bleeding inside the brain. Both types are dangerous, but understanding them helps you recognize why the symptoms appear so suddenly. The signs of stroke usually come out of nowhere. Someone may experience weakness or numbness on one side of the body, facial drooping, or difficulty speaking. They may suddenly lose vision, feel dizzy, or have trouble walking. A severe, sudden headache can also be a warning sign. The easiest way to remember the key symptoms is the word fast. Face drooping, arm weakness, speech difficulty, and time to call emergency services. Several factors can raise the risk of stroke, and many of them can be controlled. High blood pressure is the #1 cause, but smoking, diabetes, high cholesterol, obesity, and inactivity also play major roles. Drinking too much alcohol, poor diet, and chronic stress can add to the risk. Although stroke is more common in older adults, it can happen at any age, especially in people with certain heart conditions, blood clotting disorders, or a family history of early stroke. The effects of a stroke depend on which part of the brain is affected. Some people may have trouble speaking or understanding language, while others may struggle with movement, balance, or memory. Emotional changes such as anxiety, frustration, or depression are also common after a stroke, because the brain controls both mood and behavior. The good news is that stroke prevention is possible. Keeping your blood pressure under control, staying physically active, eating a balanced diet, avoiding smoking, and managing conditions like diabetes can significantly lower your risk. Early treatment and quick response give people the best chance at recovery, which is why recognizing the warning signs is so important. Overall, a stroke is a sudden disruption in blood flow to the brain that can lead to long-lasting effects, but knowing the symptoms and acting fast can save a life. Understanding the risks, making healthy choices, and seeking help immediately can change the outcome for you or someone you love. Thank you for watching, and please subscribe. Goodbye.